Okay, just hold up the card. Hi, I'm Beverly Butler. I'm going to briefly speak to you today about the problem of prescription drug abuse. Imagine walking into the ER one night with stabbing abdominal pain. You're sent to the operating room, you lose your appendix, and you're sent home a few hours later with directions to take some Tylenol for the incisional discomfort. In the past, your physician might have given you a prescription for a hydrocodone-based product, but not anymore. Since October of 2014, legislation is in place that increases the reporting and reliability of physicians. They no longer have free rein to give you a prescription for hydrocodone-based pain relievers. Our panel includes two nurses and a law enforcement officer. We hope to inform you of the problem of prescription drug addiction from an experienced medical and legal perspective. Hydrocodone belongs to a class of medications known as opiates. It's a semi-synthetic opioid medication derived from codeine. According to researcher Thyarapa Praveen and colleagues in their 2011 article titled Opioid Dependence, opioid use can result in physical and psychological dependence, when it leads to behavioral and lifestyle changes that center on obtaining and using these medications to the exclusion of other previously desired behaviors. It's termed an addiction. According to Praveen, physical dependence occurs after a few weeks of consistently taking these medications. Christine Case-Lowe writes in her 2012 article, Opiate Withdrawal, that soon after stopping narcotics, symptoms such as muscle aches, restlessness, anxiety, tearing eyes, running nose, and excessive sweating occur. If withdrawal continues for more than a few days, more intense symptoms occur. These include diarrhea, abdominal cramping, nausea, vomiting, dilated pupils and rapid heartbeat, and high blood pressure. These symptoms go away within about 3 days, but you're left with a psychological dependence that usually has to be treated with a substitution such as methadone to prevent it in the long term. Case-Lowe reports that the pleasure centers of the brain are directly affected, and these cravings and this need for a sense of pleasure lead to relapse in the long term. Social support and support groups or 12-step groups are often needed to solidify recovery from addiction. So the legislation has implemented changes to address prescription drug abuse. I take this opportunity to introduce you to my colleagues and classmates, Heidi Cooper, who will explain current legislative efforts to prevent and control this ever-growing problem. Thank you.
That's a lot. Easy. 3 minutes.